My name is Rylie Miller, and I am a physical therapist assistant from Tennessee, and I'm here to address the issues surrounding gender and gender identity in healthcare and how this can affect our fellow physical therapist assistants in the field of therapy. So first, it is very important to understand the differences between sex and gender. Sex refers to the biological makeup of a person, most notably their anatomy and their genitalia, and this is assigned at birth. While gender refers to a person's sexual identities, such as feminine, masculine, a blend of both, or neutral. So a person's gender can be the same or different from what their assigned sex is at birth. Now, sex can affect what diseases or illnesses the body can experience, such as cervical or prostate cancer. These are the two most commonly known. Now, even with a sex change, women cannot get prostate cancer and men cannot get cervical cancer. So there's also growing evidence of sex differences in the incidence, the symptoms, and the prognosis of many other health problems, including HIV and AIDS, tuberculosis, autoimmune diseases, and coronary heart disease, which is a big number one. So therefore, it is very crucial to be honest with your doctor regarding your sex and gender identity so they will know how to properly diagnose and help you with any illnesses. Now, behaviorally, men are more often emotionally suppressed because they are very commonly taught at a young age to not show any emotions such as sadness or tenderness and sympathy towards others because it isn't considered to be manly. Now, this can lead to an unwillingness to admit weakness, and this can prevent many men from taking their health seriously and from consulting with a doctor when their problems arise. So illness itself is also commonly feared among men due to its ability to reduce a man's independence, and they are more likely to have to rely on others for tasks that they were previously able to complete, such as bathing, going to the bathroom, getting dressed, or lifting. So as such, many men have an internal battle over getting the optimal care available to them from health services. Now, on the other hand, women tend to still fall below men in terms of equality, and this applies in healthcare as well. So it is often harder for women to get access to their health care in different societies around the world, particularly in poorer areas and areas where discrimination is stronger. Now, women also tend to have a harder time getting to and from their healthcare services than men because they are less likely to have the same transportation that men have, and this is especially true among the elderly. Now, they are also less likely to have the free time to get to the doctor due to time restraints from taking care of children, taking care of other family members such as a spouse or a parent, or having to work at another job. So understanding these issues among both men and women can improve the quality of care that's provided to that patient and can increase the likelihood that the patient will feel comfortable and return for further care. Now, patients who are experiencing a change in their gender identity can face these same problems and more. So understanding a patient's gender identity and what pronouns they prefer is very important for first providing a welcoming and trusting environment by showing the same respect and care that any other patient would receive. Now, many people who identify with a different gender than what their assigned sex at birth is that they face opposition in their community or their jobs. So when they come to their physical therapy session, they should be able to experience a very safe, judge-free area. And this is going to improve their health care and their feelings of acceptance. Now, when you encounter a patient who identifies as the opposite gender, it is very crucial to first understand the patient's preference for therapists, be it male or female. So for instance, a biological male identifying as female may be immensely uncomfortable with having a male therapist perform any type of manual therapy or modalities that involve close contact. So it is also key to maintain a judgment-free environment and to not allow any personal biases to show. So we are here to help people, and we should be aiming to provide the proper care to any patient who walks in our doors, regardless of what their sex is, their gender identity, their sexual orientation, their religious beliefs, political beliefs, their income, or their race. So if an employee is unable to do this, they would be responsible for finding a therapist who would be able to properly assist the patient. Otherwise, you risk offending or emotionally hurting that patient, and this can slow down the healing process of their body, and they will continue to have a negative disposition towards receiving therapy or healthcare in general, and they may be less likely to seek professional healthcare when they're ill or injured. Remember, we are here to heal, and we should aim to do that for all, despite any personal beliefs. So there has been some improvement over the years regarding research towards gender-based medical intervention, but one problem that's still present is that women are vastly underrepresented in clinical trials, and this includes a decreased understanding of how specific drugs or treatments may react in the female body. Now, according to an article called Sex and Gender Differences in Health, published on the National Center of Biotechnology and Information, women have a lower body surface, they have a difference in kidney function, drug resorption, and metabolism by their hepatic enzymes and the excretion, and these all cause a difference in how the drugs move within the body. So this causes many drugs to require a different dosing in males and females to achieve the optimal effects. Now, one area that is unfortunately still underrepresented by women in clinical trials is the cardiovascular trials. Now, women are 1.5 to 2 times more likely to develop an adverse reaction to prescription drugs than men, and this can be due to the fact that female-specific symptoms and effects are still often overlooked in cardiovascular research and studies. Now, due to the lack of awareness regarding cardiovascular diseases in females, the American Heart Association did create the Go Red for Women campaign, and this is to increase awareness of positive lifestyle changes in women, such as their exercise, their nutrition, and their stress reduction. Now, this should be applied to all aspects of therapy and healthcare and should be equally pushed for both men and women. Now, as I stated earlier, there has been an increase in adding women to clinical trials, which will assist the drug development companies in understanding possible side effects and reactions that women may face that are different to men. Now, this will also benefit men as well because they could also have a gender-based medicine that is better suited to their biological components, such as their organ production and drug resorption, instead of trying to create a one-for-all medication that isn't properly suited for either sex. So physical therapy can also be altered for men and women regarding their physical makeup. So women are more prone to joint laxity, especially during menstruation and pregnancy. And this should be taken into consideration when creating a strengthening program. So when the joints are increasingly lax, there is a very real and greater chance of re-injury. Now, men, on the other hand, they have a larger muscle mass, but tend to have less joint laxity and range of motion. And this should also be considered when correcting their posture alignment and when teaching their proper form for exercising. So training can also be utilized for anyone working in healthcare to ensure that proper and appropriate care is being offered to all their patients. So this training can include ethics, decreasing biased opinions, proper body language such as eye contact, touching, any tactile cues you give, using the proper terms and definitions that regard the LGBTQ plus community, and how to best address other patients that may be causing another patient to feel uncomfortable with either their own body language or verbal language. So understanding these aspects can create a more enjoyable and therefore a more effective therapy session for both the patient and the therapist. We entered this field because we love what we do and we love to help others. So please take this information and go do what you do best. Help heal. Thank you so very much for listening. Bye.